I'm Debbie Ristvedt. I am a cataract surgeon currently in practice with Vance Thompson Vision in Alexandria, Minnesota. I am passionate about eye care and helping my patients receive the best possible care for their vision needs. Most people do not realize that cataracts happen to be the leading cause of vision loss and blindness in the world. While cataract surgery has been performed for centuries now, the most progress in terms of innovation and technology advancement has actually occurred within just the last 20 years. As a third-generation ophthalmologist, I have witnessed my grandfather and my father face and overcome many obstacles within their careers related to cataract surgery and intraocular lens options. It is amazing to see how far and how quickly technology has advanced over just a short period of time. As a result, we are providing never-seen-before solutions for our patients' sight goals today. Now, more than ever, patients in need of eye care can feel confident in experiencing a safe and successful outcome for surgery. The future of cataract surgery innovation and intraocular lens technology continues to evolve, and as advancements come to market, the one thing that is clear is that uncorrected visual acuity drives patient satisfaction. As we strive for patient satisfaction within cataract surgery, the abundance of resources to help us deliver positive results for our patients is also evolving. For example, we now have new formulas for IOL calculations and new technology preoperatively and intraoperatively that help guide surgeons to achieving precise results. However, there are certain items that continue to challenge our post-refractive outcome. Some challenges that we continue to face and are seeking better solutions for include predictable post-operative IOL positioning, post-operative corneal power surprises, and axial length calculation accuracy. In addition to those challenges, we are also looking closely at solving preoperative hurdles. There are currently 4 notable challenges with premium intraocular lens technology. The first being the inability to consistently meet patients' expectations. We all have certain patients that have a high level or sometimes even unrealistic expectations. These individuals may have type A personalities, they are perfectionists, and are very picky about their post-refractive results, and if we fail to deliver on their expectations, they are unhappy. Sometimes it just comes down to the fact that making an intraocular lens choice or understanding the information presented can be confusing to the patient. Many times when asked, patients simply don't really know how they want to utilize their vision. Other IOLs can cause more glare and halos as well as poor contrast sensitivity. Ocular pathology can be a limiting factor. As an example, patients who have a history of retinal disease may not be a good fit for a multifocal lens. Lastly, we do look at laser fine-tunes to make sure that we get patients to a good and happy spot if they need correction of residual refractive error. So, if the practice doesn't have easy access to a corneal refractive surgeon or to a LASIK suite, this can be a roadblock for optimizing the IOL that has been placed. Learning objectives. The light adjustable lens has been a simplifier in our practice as it can encompass a lot of the patients that we see on a day-to-day basis. In this lesson, there are 4 learning objectives that we will focus on, all in which they are designed specifically to help you understand how RxSight's highly regarded light adjustable lens works and what makes it unique and beneficial to the patient's vision goals. By the end of this lesson, you will be able to understand the unique benefits of the light adjustable lens, confidently answer any questions patients may have when considering choosing the light adjustable lens, and be able to support your answers with positive clinical data when appropriate. Educate patients and set expectations on pre- and post-surgery visits in order to provide a positive patient experience. Understand your role as a technician when preparing patients for pre- and post-op care. What is the light adjustable lens? The name speaks for itself in the fact that this is the only IOL that is adjustable. That means that the patient will be able to provide feedback after the cloudy cataract is out and be an active participant after surgery when we customize their vision to their liking. I find that the patient is truly able to test drive their vision before finalizing the result. Focal points for alternative lens options, which give patients more freedom from glasses, are fixed, meaning the IOL will give the patient vision at certain focal points, but once implanted cannot be changed, other than with a corneal refractive procedure or taking the patient back for surgery for a lens exchange. The optics, or the way light is refracted via the other lens options, are different in the fact that they shift or split light in order to deliver vision at certain focal points. As a trade-off, they can cause visual disturbances such as glare and halos, which some patients may not tolerate. The optic body of the light adjustable lens, on the other hand, is the same throughout without steps or rings, providing clear, customizable, and adjustable vision for patients. The technological design of the light adjustable lens is unique in that the lens itself is made of photoreactive UV absorbing silicone that changes the shape and power of the implanted lens in response to ultraviolet light. This IOL requires enlarging the incision to 2.75 millimeters at the time of surgery and is folded slightly different when implanting. However, you can tell your patients that cataract surgery will be performed in the same fashion. This customizable technology gives the patient the best possible vision after surgery without negative side effects such as halos and glare. If the patient has demonstrated adaptability to monovision, the surgeon can even customize the patient's vision and provide what is often referred to as blended vision or monovision. That is, one eye is set for distance and the other eye is set for near vision, giving patients the best of both worlds and reducing patients' dependency on glasses. What sets the light adjustable lens apart? I have seen firsthand in my practice outstanding results in happy patients who have chosen the light adjustable lens. It has been a proven solution for dramatically reducing the refractive errors that have always been just part of surgery. And in my practice, I am achieving results nobody could have ever imagined a few years ago. I am not the only surgeon in the country delivering great results with the lens. In a study of 391 eyes and over a period of 6 months, the percentage of patients achieving uncorrected visual acuity was staggering. 70% of patients can see 20/20 or better. 92% of patients can see 20/25 or better. And 99% of patients can see 20/32 or better. Of these same patients, 92% of them achieved desired vision within 0.5 diopters of intended correction. As a reminder, diopter is a unit of measure relating to the refractive power of the lens. The reason this is significant is because with traditional IOLs, only 6 out of 10 patients typically achieve their target vision. Nailing the intended target within 0.5 diopters with consistency is remarkable, and it rivals the level of precision we can deliver our patients through LASIK. Preoperative care. Preoperatively, the routine for us in our practice is the same as any other lens implant. A patient gets an OCT of the optic nerve and macula, topography of the cornea, as well as biometry scan to select the most precise power of the IOL. With the light adjustable lens, I find that I'm not as worried about completely nailing the target prior to operating on the patient, because I know the patient will be involved in the journey post-operatively, and I can optimize the IOL after they have healed. Pre-operatively, there are no special instructions. Our surgical counselors are able to make the appointments prior to surgery so that patients and our staff know the time interval for adjustments ahead of time and be able to plan accordingly. Post-operative care, light adjustments using the light delivery device. As mentioned earlier, the light adjustable lens is made of a special material that changes in response to the ultraviolet light treatments, delivered via the light delivery device in your medical office. An average of 2 to 4 painless and non-invasive light treatments, each lasting approximately 90 seconds, are required for the adjustments to be made. The total number of light treatments is based upon the achievement of the patient's desired visual outcomes. Remind your patients that custom vision and fine-tuning is worth the extra effort to achieve the best results possible. Now, when we look at the patient experience roadmap, patients have multiple visits starting at day 1, week 1, at 3 weeks and beyond. At each of these visits, we make sure that we have a precise manifest refraction and that the patient is wearing ultraviolet glasses to protect the lens from ambient light. We are asking the patient how they want to utilize their vision as they're involved on this journey. That means that we're really listening to the patient's vision goals before they're ready for their first light treatment. At about 3 weeks, once the lens has settled in place, is when we really start to optimize the IOL. When the doctor begins to optimize patient's vision, UV light from the light delivery device is directed to the lens macromers. Macromers are tiny special particles found in the path of the light. These particles found in the path of the UV light connect with our other particles, forming polymers. The unpolymerized macromers then move to the exposed areas, thereby changing the curvature of the lens and causing precise shape and power change. This process is repeated 2 to 4 times at different visits until we've achieved the patient's desired results. In our practice, we like to optimize the IOL 5 to 7 days apart, but waiting at least 3 days minimum in between treatments. Once the patient is at their vision goal, we are happy with their manifest refraction, and the patient is happy, we begin to lock in their vision. There are 2 lock-ins needed, 3 to 7 days apart. The lock-in beam from the light delivery requires the entire lens being exposed to light, and all the macromers are then polymerized. A question that frequently comes up regarding the use of UV protective glasses for 5 to 6 weeks postoperatively can be addressed by simply letting patients know that in order to ensure the surgery is cemented with a positive result, the doctor strongly recommends the use of UV protective glasses throughout the post-op period. The light adjustable lens is now coated with active shield, which provides redundant protection from ambient UV light sources, therefore reducing the effect of ambient UV light to the lens itself. This redundant protection has been extensively tested by exposing the light adjustable lens to various UV emitting light sources that may be present indoors and outdoors. This added protection gives providers more of a peace of mind with non-compliant patients. Nevertheless, the answer is still to recommend the use of UV protective glasses. Limitations of the light adjustable lens. What we're finding with the light adjustable lens is that the results do rival LASIK outcomes, having 92% of patients within a half a diopter of target manifest refraction spherical equivalent. However, there is no such thing as a perfect solution, and there are limitations and contraindications to using this lens. If patients cannot come in for follow-up appointments or multiple appointments, this may not be the best lens for them. We want to confirm that patients dilate 6.5 to 7 millimeters preoperatively. Our technicians make sure to document how well they dilate prior to cataract surgery. If the patient has poor fixation, it may be difficult to deliver light treatments postoperatively, as they may need to be physically adjusted at the light delivery device. Additionally, we're looking at systemic medication that may increase sensitivity to UV light. The ideal patient. All in all, the light adjustable lens is a simplifier in our practice and helps us serve a wide range of patients. I think about cases where patients want the most precise distance vision and have some astigmatism. This is a wonderful lens for those patients because I feel confident that I am going to hit their target refractive outcomes and the patient will have great clear vision after surgery. I look at patients who have a lot of astigmatism where fine-tuning their vision to get them as close as possible to clear vision is challenging. High astigmatism is difficult to correct because for every degree I'm off, the patient will have decreased efficacy of that lens. With a light adjustable lens, we can precisely treat up to 4 diopters of astigmatism, increasing the likelihood of hitting target refraction and correction of the patient's astigmatism. Patients who have had the benefit of monovision contacts are another great example where the light adjustable lens be dialed in the lens power to the patient's desired focal point. Typically, one eye would be adjusted for distance and the other eye would be adjusted for near. It's important here to note that not every patient will tolerate monovision, which is why patients who have already demonstrated comfort with monovision contacts are an ideal patient for monovision cataract surgery. Another great patient for the light adjustable lens are those patients who have had prior corneal refractive surgery. These patients are typically more difficult to predict outcomes with a standard IOL because their cornea has been previously altered. Because the light adjustable lens itself is optimized postoperatively, not the cornea, providing pretty accurate results. Conclusion. I've really loved being on this journey with utilizing the light adjustable lens. And it is fun to watch our technicians get excited as patients are being optimized at every visit. We even do a celebration and cheer at the last lock-in, which is really fun. Remember that your role in patient care is crucial to the success of the light adjustable lens. From paying close attention to performing a precise manifest refraction, to ensuring patients properly dilate, discussing with patients what their lifestyle is like, understanding and documenting the patient's vision goals, reminding patients to wear their UV protective glasses, helping the patient feel comfortable and at ease with each visit, and of course, supporting the doctor in performing routine exam room tasks before each light adjustment. I want to thank you so much for listening to this lesson. I wish you continued joy in your career as an ophthalmic professional.